Welcome back to Dr. Khares Differential Diagnosis. Today we are going to learn multilocular radiolucencies on dental radiographs. These are the radiographs. The radiograph A is traumatic bone cyst and radiograph B is ameloblastoma. These are pseudomultilocular radiolucencies. Both lesions proved at surgery to be unilocular. In this radiograph, you can see maxillary sinus showing multilocular pattern. These are the periapical radiograph of maxillary and mandibular anterior region. Marrow spaces showing soap bubble pattern can be seen. The arrow in A identifies a multilocular bone marrow space at the apices of central incisor root. These are different radiographs showing multilocular cyst. Radiograph A shows residual cyst. Radiograph B shows botryoid cyst. Radiograph C shows radicular cyst, while radiograph D and E shows dentigerous cyst. These are the clinical and radiological pictures showing ameloblastoma. The picture A shows facial asymmetry caused by the expansion of left ramus in a 68-year-old man. Picture B shows intraoral swelling in the third molar region of the same patient. The ulcerated surface was caused by trauma from a maxillary molar. Picture C shows left lateral oblique radiograph in the patient, while picture D shows radiograph of the surgical specimen showing soap bubble pattern. These are again pictures of ameloblastoma. The radiograph from E to J shows radiograph of other ameloblastoma. Honeycomb pattern are apparent in E, F and G. Soap bubble pattern are evident in H and I, while the angular multilocular pattern is shown in J. These are various radiographic pictures of giant cell granuloma. In radiograph A, arrow indicates the lateral limit of soap bubble lesion. In the radiograph B, large soap bubble lesion producing marked expansion in the mandible of 5-year-old boy can be seen. In the picture C, lesion in a middle-aged woman can be seen. This radiograph shows brown giant cell lesion of hyperparathyroidism. The soap bubble pattern is evident here. These are the picture of a brother and sister having cherubism. In picture A, the clinical appearance of bilateral expansion of the rami in 12-year-old boy can be seen. Picture B is a panograph revealing the bilateral soap bubble expansion of the rami. The maxilla was not involved in this case, while the picture C and D is of the 7-year-old sister of the patient. The maxilla and mandible are involved here. The superior tilt of the eyeball gives the cherubic appearance. These are the radiographs showing odontogenic myxoma. Radiograph A and B are orthopentamograph and radiograph of a surgical specimen. Radiograph C is the lateral oblique radiograph of another patient, while radiograph D is the radiograph of surgical specimen. Picture E is the myxoma producing a smoothly contoured oral swelling. Picture F and G are the radiograph of the lesion shown in E, while H is the photomicrograph of myxoma. These are the pictures of radiograph showing multilocular odontogenic keratocyst. These are the radiographs of aneurysmal bone cyst. The radiograph A, arrow indicates the faint soap bubble pattern of a lesion in the premolar region. Picture B and C are the posterior, anterior and lateral oblique radiograph of another lesion, while picture D is the radiograph of the surgical specimen from a 12-year-old girl of the lesion shown in B and C. Picture E and F are panograph and occlusal radiograph of aneurysmal bone cyst in a 20-year-old woman. The soap bubble pattern and retention of thin cortex are characteristics of this benign condition. Picture G is photomicrograph showing a large vascular space, and multinucleated giant cells are frequently present in aneurysmal bone cyst. This radiograph shows metastatic renal adenocarcinoma. These are the pictures showing intrabony hemangioma. The radiograph A is panograph showing multilocular expansion of the right ramus and the malposition of the developing right mandibular molars. Picture B shows multilocular lesion in the frontal bone. Picture C is histologic study showing many vascular spaces between the radiating spicules of bone. These are the various pictures showing rare multilocular radiolucency, where A is ameloblastic odontoma, B is intrabony fibroma, C is malignant ameloblastoma, D is intrabony fibroma. More radiographs of rare multilocular radiolucency, where E and F are the panographic and occlusal view respectively of intrabony central mucoepidermoid carcinoma of the mandible. These are the pictures of calcifying epithelial odontogenic tumor of the left mandible. Various views of same case showing multilocular pattern can be seen. Picture A and B are periapical radiographs, while picture C is occlusal radiograph of calcifying epithelial odontogenic tumor. These are the pictures of pseudotumor of hemophilia of 3 cases, where picture A is the right side of panorex radiograph showing the multilocular lesion in 16-year-old boy with severe hemophilia. Picture B and C are another case of pseudotumor in the left ramus of 23-year-old patient with hemophilia. Panorex radiograph, which is the picture B, shows the multilocular expansion of ramus, coronoid process and condyle. Crop posterior anterior radiograph of the affected ramus, which is the picture C, shows the mediolateral dimension of multilocular expansion. Picture D is another case in an 11-year-old boy with severe hemophilia. The arrows in B and D identifies the lesion. Here the picture A is the arteriovenous malformation in a 25-year-old man, while picture B is the arteriovenous malformation in a 10-year-old patient, and the picture C is the intrabony neurolemoma. Now this is the unilateral case of Burkitt's lymphoma in a young girl. Lateral oblique radiograph showing a rarefied and multilocular pattern of bone loss. These are the pictures showing ossifying and cementifying fibromas. The picture A is a multilocular appearing lesion in the premolar and first molar region of mandible in a 13-year-old boy, while picture B is another multilocular appearing lesion in the premolar and molar region of a 28-year-old woman. You can go through the features of lesion producing multilocular radiolucency from this table.